Is breast cancer treatable? Do you always need chemotherapy? Is the surgery complex? How successful is treatment for breast cancer? Stay tuned to find out. Hi, my name is Tasha, here to help you navigate the world of health in general and breast cancer specifically. Breast cancer is the commonest disease that affects women. However, one person's breast cancer may be quite different to another. Thanks to modern medicine, treating breast cancer is no longer a one-size-fits-all approach. It's tailored specifically to your cancer, ensuring the best possible outcome. So, what are your options? Well, there's surgery, chemotherapy, radiotherapy, immunotherapy, and endocrine treatment. But here's the thing. Which treatment comes first depends entirely on your cancer type. Some may have surgery first, some may have chemotherapy first. It really does depend on the cancer. In addition, you may not get all of the treatment options available, and that's why you can't compare your cancer to someone else's cancer. You may not realize that there are many different types of breast cancers, and this means that there are also many different ways to treat it. So, let's start with surgery. Surgery is done to remove the cancer from the breast, so it is for local treatment, treating the cancer at its source. Broadly speaking, surgery will either be breast conservation, also known as a lumpectomy, or it can also be a mastectomy where the entire breast is removed. If you have a mastectomy, you can either go flat or have a reconstruction, where we can reconstruct a new breast for you. The decision as to what type of surgery you'll be recommended depends on many factors. The size of the tumor, the size of your breasts, whether the cancer is just in one place in the breast or whether you may need radiotherapy afterwards, your lifestyle, as well as the characteristics of the cancer itself. Your surgeon will discuss what they feel would be the best option, and ultimately, it is a fully informed two-way discussion. Next is chemotherapy. Now, chemotherapy is given to kill cancer cells, not only within the breast, but also those that might be circulating around the body. It is a drug treatment that aims to treat the cancer systemically, meaning the whole body, rather than just locally, which is what surgery does. Sometimes we give chemotherapy first before surgery, and there are different reasons why we do this. It is mainly dictated by the type of cancer you have as well as the size of it, and this is called neoadjuvant chemotherapy. You can also be recommended to have chemotherapy after surgery, and this is also known as adjuvant treatment. And the aim of this is to minimize the cancer from coming back in the future. There are also different types of chemotherapy drugs available depending on the cancer type. Chemotherapy can be quite a challenging treatment, and there are quite a few side effects, but people react to this treatment differently. Some tolerate chemotherapy better than others. And unfortunately, it is likely you will also lose your hair unless you have a cold cap whilst having chemotherapy, which can minimize hair loss. And if you want to learn more about chemotherapy, I have made a video talking about it in more detail, and I will leave the link below so you can check it out. The other thing to remember is that not everyone will need chemotherapy. Some may have surgery followed by the next treatment, which is radiotherapy. Now, radiotherapy is again used to treat the cancer locally. It is targeted treatment, meaning it is designed to be delivered to exactly where the cancer was following surgery. And the aim is to kill any potential remaining cancer cells that might be lurking around. If you have had a lumpectomy, in other words, you still have your breast, then it is likely you will be recommended to have radiotherapy. And this will be given either daily for 5 days or 15 days. There is a lot of planning when it comes to radiotherapy, which allows only the important areas to be targeted by the treatment. And so the important organs such as the lung and the heart are going to be protected. And most people tolerate radiotherapy reasonably well, although tiredness can be an issue. And some people may have their skin react to radiotherapy as well. Immunotherapy. Breast cancer treatment has thankfully advanced over the past years, and now we can add more effective drug therapy as part of treatment. Immunotherapy uses drugs that help our own immune system recognize cancer cells and destroy them. And again, not everyone will be suitable for immunotherapy. It depends on the cancer type that you have. If your cancer is HER2 positive, then you would have been recommended to have immunotherapy. In this scenario, the cancer cells are expressing a large amount of the protein called HER2, also known as human epidermal growth factor receptor 2. Here, you would have been given immunotherapy such as trastuzumab, also known as Herceptin, that will target these receptors. Other drugs include pertuzumab, also known as Perjeta, that can be given in combination with trastuzumab. There's drugs called pembrolizumab, palbociclib, abemaciclib, to name but a few. These treatments are available also to those who have developed secondary or metastatic breast cancer. I hope this video has been helpful. Let me know what your thoughts are in the comment section, and I'll see you in the next one.